We're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. This model of infectious diseases causation is called an epidemiological triad. The first component is the agent. This is the organism that causes the disease. It can be bacteria, viruses, parasites, or fungi. Second is the host, who is the target of the disease. The third component is the environment. This refers to the surroundings and conditions that are external to the host that allows the disease to be transmitted. In addition to these three components, transmission pathways between each of these allow the spread of infection. These transmission pathways can be direct or indirect. In direct transmission, the organism is transmitted directly to the person. This could be through touching, sexual intercourse, coughing, or sneezing. On the other hand, in indirect transmission, the organism is transmitted via an intermediate. There are several ways that this can occur. It can be through contaminated objects such as toys, soiled clothes, or even through food or water. It can also be through an intermediate vector, such as a mosquito or a tick. Now that we know how infectious diseases are transmitted, let's have a look at how to control them. Changing behavior can reduce or eliminate the risk of exposure to an infectious agent and prevent their spread. There are many different and sometimes simple health behaviors that can be adopted, including using condoms to eliminate or reduce the risk of sexually transmitted disease, regular hand washing, having a healthy diet, or using insect repellents. Behavior change is an important target of health promotion programs. Vaccines are one of the biggest successes of public health and have led to reductions and, in some instances, eradication of infectious diseases. Routine immunization of children has led to a dramatic decline in diseases like measles, diphtheria, and pertussis, saving countless lives. Vaccines not only protect the individuals, but by increasing the level of immunity in the community, also protect others. This is called herd immunity. Medication has been one of the mainstays of managing infectious diseases. Antimicrobial medication work by either killing the microorganisms or inhibiting the replication. They're not only used in treating diseases, but in some situations can also be used to prevent infections before or after being exposed to a disease. Pre- and post-exposure prophylaxis. A significant issue in the fight against microorganisms is antimicrobial resistance. This can happen when microorganisms develop resistance to drugs that were once effective against them. Antimicrobial resistance has been accelerated by the inappropriate or excessive use of antimicrobial drugs and has become a significant issue in the fight against microbes. Surveillance is a tool that is used to control infectious diseases. It is used to monitor diseases and their trends, characterize patterns of disease, and detect outbreaks. Surveillance can also guide the prioritization, development, and evaluation of disease control programs. In most countries, there are a number of diseases or conditions that are required to be notified by law. These are called notifiable diseases. Laboratories and doctors routinely send information to health departments who monitor them and act accordingly. Modifying the environment is another way to control infectious diseases. This includes activities like vector control, which is the eradication or control of vectors that can transmit diseases like malaria and dengue, ensuring that there is safe water supply, which leads to a reduction in waterborne diseases like cholera, Cryptosporidium, and hepatitis E, and improving sanitation facilities and hygiene, which can reduce the spread of diseases like Shigella, hepatitis A, and Salmonella. Other environmental measures include improving housing and working conditions, ensuring food safety, and enhancing air quality. Infection control in healthcare facilities is important because infections can spread quite rapidly in these facilities if proper precautions are not taken. Ways to prevent the spread of infection include proper sterilization of equipment, wearing appropriate personal protective equipment, isolating infectious patients, strict hand washing practices, regular cleaning, and having a good hospital surveillance system so that these infections are recognized and managed early. There are various other factors that contribute to the control of infectious diseases. These include broader measures like improving the social determinants of health, such as education and employment, having strong healthcare systems, and having an effective health workforce. Finally, the One Health concept recognizes that human health is closely connected to the health of animals and the environment. Therefore, successful control of infectious diseases requires the cooperation and collaboration of many specialties, including veterinary and environmental sciences. So that's a quick overview of controlling infectious diseases. We've taken a quick look at how infectious diseases are transmitted and a number of ways to control their spread.